We can hear you, Greg.
All right, perfect. All right. Hello, everybody. Hope everyone is doing well. My name is Greg Turner. I'm currently a second year naturopathic medical student over at Sonoran University in Tempe, Arizona. But I was born and raised in Rochester, Michigan, and love Michigan and always brag about it to everyone out here. People out west, they don't know how great of a state it is. But I figured just start with a little intro and background on myself. I am someone who my friends and family would label as a health nut, and I've just kind of always been that way. I've just always been fascinated with the human body, and growing up, I had 13 broken bones by the time I was 13 years old. And not because there's anything wrong with me. I was just kind of an above average and stupidity child that got injured playing sports. And so I was in and out of hospitals, medical centers a lot. And so that's probably where a lot of the passion initially came from. But I actually went down the business track in undergrad, and I had kind of a meandering path, but graduated from USC's business school 4 years ago and didn't really know anything about naturopathic medicine or oncology and cancer treatment and stuff. But at the background of everything that I was doing in school and my whole life, there's always been that just intrinsic curiosity. And passion I had for the human body and the health field. And long story short, I worked for a year after undergrad in a business position for a technology startup, had the job I thought I wanted. On paper, everything was great, but was just so bored and spent all my free time really just listening to podcasts and health and reading and uh, basically decided to just make the leap of faith and do a full 180 in my career. And so I took some additional classes after that, evaluated conventional MD/DO school. And when I found out about NMD school, that was kind of it for me because I seen a lot of the beauty within the conventional allopathic medical care system, and obviously in acute care settings there is incredible value in Western medicine, but I've also seen a lot of its limitations firsthand with myself and people in my family. So when I found out that there was a medical school that combines integrative medicine, Eastern medicine modalities with the best of Western medicine, it was kind of a no-brainer for me. And so now I'm in my second year, and I wanted to share a bit about an experience I had 2 months ago that should be relevant for all of you in the American, Cancer Society Club here, which was the time I did my clinical observations at the Envita Medical Center out in Scottsdale, Arizona. So essentially, what Envita is it is an integrative oncology clinic, which provides personalized cancer care that goes way outside the conventional standards of care that most cancer patients have primarily exclusive access to, mainly because they don't know that there is this type of integrative care that exists, but a lot of it is just access and cost because what they do is outside of the insurance system. But the reason my time there was so impactful and I want to share with you is because they have published a few papers now, and they deliver on average 35-fold better response rates to their cancer treatment protocols relative to conventional oncology protocols, with 95% of patients having fewer side effects. And so I wanted to drill into some of the innovative stuff that's going on there and other integrative cancer treatment centers in the world that is really inspiring, I find, and hopefully, at the very least, you guys will find pretty interesting. So, just to kind of set the stage, as I'm sure a lot of you guys are probably familiar with, there's kind of like three main buckets for treating cancer. And the first is chemotherapy, then there's immunotherapy, and then there's surgery. So there's pros and cons to each of these, and usually that's why they're used in conjunction. But for chemotherapy, for those of you that aren't fully aware exactly what that is, essentially it's cytotoxic drugs that directly damage or disrupt dividing cells with the aim to kill tumor cells faster than normal cells. So the pro is that chemo is really good at killing cancer cells, but the con is that it's also really good at killing other healthy cells in the body. So typically, what's done with conventional oncology is for a given cancer, there are guidelines that are set forth by various organizations that essentially say you have this cancer, you have, these two, three options to treat that cancer, because over time we've seen that typically those chemos work best for most patients, but it's not personalized. It's just kind of going off of the standard of care practices, right? So, um, with that, there are people that, based on their specific makeup and their tumor makeup and their specific cancer, those chemotherapies aren't gonna, respond as well to some people as it might for others. So, something that they do at Invita and other integrative oncology clinics is starting with a chemosensitivity analysis. And so, what that is they'll actually take antigens and cells from that tumor and they'll test it against all of the available chemotherapies that exist. So again, when you're using guidelines, there's only a few chemos you might have access to, but in reality, let's just say, for example, there's four chemos that are under the guidelines that are insurable, but there's 30 different chemotherapies for that specific cancer. Um, doing doing it this way and going outside the insurance model, you're able to test all of the chemotherapies out there against the specific tumor and see what chemotherapy specifically respond the best to that individual's cancer type. So from there and using that data, you can be very precise and personalize the chemotherapy treatment for that individual patient. So that is the starting point, which is really cool. But you can go even further than that, right? So a lot of you are probably aware of the systemic toxicity of chemotherapy and how that ravages the body, and a lot of patients ultimately elect to not finish their chemo treatment just because of how awful they feel when doing them. And so, a way that Envita and other places like it bypass this is they'll direct the chemotherapy straight into the tumor itself. It's a procedure they call chemoimmunoprecision injections, or CIPI. It's basically a catheter-based approach, which delivers microdose chemo directly into the solid tumor. So, whereas in conventional chemo, you might get 5% absorption into the tumor and 95% will go and wreck other parts of the body. Doing it this way, you can get almost the exact opposite. More like 95% goes to the tumor, 5% going systemic and harming other cells of the body. And so that's a really useful tactic or technology that's used, I should say, at centers like Envita. And another thing, in terms of delivery method, which helps to lower the systemic toxin or toxicity, is called insulin potentiation therapy, which is just a fancy way of saying that cancer cells, they are hungry for glucose more than your normal cells. So they just take up glucose. They have these receptors, these 1 and 3 receptors on their surface that they'll preferentially take up glucose before your other cells do. So they'll basically give insulin, artificially lower the blood sugar of a patient, and then they'll deliver the chemo with dextrose or a form of glucose. And so it's a type of Trojan horse where the cancer will take up that sugar, but with the sugar, the chemo is actually delivered simultaneously with that. So it gets into the cancer cells more directly and then the tumor more directly. And so you can mitigate a lot of the toxic load through the rest of your body in doing it that way. So those are a couple cool things as it pertains to chemo. Another big thing, obviously, immunotherapy being a huge focus in cancer treatment. And so, what that is essentially is a treatment or a group of treatments that help the immune system to recognize and attack the cancer or move the brakes that prevent the immune killing. So, whereas chemo, kills the cancer directly, this is going to train your body to kill the cancer more effectively. And so, in these integrative medicine, centers, they don't use the one size fits model there either. They can also personalize immunotherapies based on immune and biomarker analysis of the tumor and tumor cells to optimize the benefit and reduce the side effects, which the side effects I don't think get talked about enough in cancer treatment because, that's really what makes it so grueling for a lot of patients that have to undergo just an awful experience already. But on top of that, you're gonna, destroy their vitality and the hair, they're going to lose their hair. And it's just an awful process from the side effects of the medicine itself. So I think that, this model overall is really going to probably gain more steam in the future just because of that alone. Even if it didn't have the arguably better patient outcomes that it provides. So the last aspect though is surgery. So this is another huge thing where if you have a tumor, a lot of times you have to go in and surgically remove that. And so that's just going to be indicated a lot of the times, and there's not really any way of getting around that. But other times, depending on what organs affected, there's something called cryoablation, in which you basically destroy a tumor by freezing it to death. And so this is a lot more minimally invasive because essentially a probe is inserted into the tumor just through the tissue under imaging guidance, and then extremely cold gas rapidly freezes the tissue. And so, like, why this is so cool is because traditionally, say, someone has a breast cancer and the standard of care is to give that woman or man a lumpectomy, and basically the surgeon's going to cut out the tumor, but like a large portion of the breast as well, and so that's going to leave a scar, contour change, and it's just a really unfortunate procedure that a lot of people who have experienced breast cancer had to undergo. But cryoablation offers a bit of an alternative where when you freeze the tumor inside, the tumor actually dies in place. So the body slowly reabsorbs it over weeks to months, and the architecture of the breast actually remains intact. So instead of removing the tissue, basically your body just biologically dissolves it. And so that I think is a really cool tool that's out there as well, and a good option for people to know about. And then, of course, because I'm in naturopathic medicine, and Vita is an example of a clinic that's run by naturopathic physicians. Some of the additions or naturopathic adjuvants to the typical or more technological kind of advanced care from the Western side I just shared with can all be enhanced and made better with these naturopathic adjuvants. So three buckets here too. There are some that have direct cancer killing properties, so work more like in the chemo sense. So things like polyphenols, curcumin, IV vitamin C. And then there's also chemosensitizers though. So these are things that actually help chemo itself to work more effectively. Things like quercetin and berberine, a couple examples of that are leveraged out there. And then immunosupportive as well, just things like omega-3, vitamin D. So in the future, I think there's going to be, more in Vitas, and as people gain more awareness of stuff like this. But I also think that screening and tests are going to be leveraged more heavily because if you can catch a cancer earlier, it really, really increases the survivability of the disease. So if you catch it in localized stage 1 or 2, where it's confined to the organ or region, the 5-year survival rate is typically 70 to 99%. That's average across cancers. Obviously, it's going to vary based on the type of cancer, but just on average. However, if it gets to a regional stage where it has spread to lymphatics and the surrounding area, the survival rates drops to 40 to 85% on average. And then if it metastasizes and goes systemic, now you're looking at as low as, 5% survival rate. So I think that, and I hope that there's a lot more advanced screening and that becomes more prevalent as we learn more about cancer and how to screen and test for it. So I've got a lot of other stuff that I'm hoping you guys find interesting outside of the cancer front, just general health advice, protocols, tips, insights, whatever. But I want to pause here and see if, there's any questions you guys might have based on any of the stuff pertaining to integrative oncology treatments.
Yeah. So I know that you said the treatments for the way that you do it are like uninsured. How do you guys find like ways to help patients pay for it if they can't pay for it? Like, because most people go through insurance.
Right. That is a great question. And I will be honest with you. I know I like can't properly answer that, but I know that at Invita at least they have like a whole department there that helps patients going through their treatment protocols with the finances of it. And I imagine it has to, there's going to be loans in some instances, and it is an unfortunate reality that that type of care currently is not as broadly accessible as it should be. But uh like I guess on the bright side of that to a degree, Envita actually has created health, what they call health like assurance basically, which they form their own insurance company. Um, and they're rolling that out currently to cover more integrative care options, not just for cancer, but beyond as well. And so I think in the future, with just the increasing demand for this type of care, that this type of stuff will become more accessible and more covered by insurance groups, whether it's Envita or the big names, the Bucas, Blue Cross, United, yada yada, that follow suit. Just because it works so well and that's the care that people want. But that's a great question.